Welcome to Salinas Valley Memorial Healthcare System's Ask the Experts. I'm Claudia Otero. Today we're going to be focusing on women's health. We will be discussing health and wellness, birth control, family planning, pregnancy, the importance of yearly screenings, including those that detect certain types of cancers. We'll also talk about whether or not pregnant or breastfeeding women should receive the COVID-19 vaccine. We'll talk about menopause, and we'll also talk about the Blue Zones Project. If you have questions, please type them up in the comments section, and at the end of this presentation, our physicians will answer those questions. But first, let's meet our experts. Dr. Rachel Beck is a practicing OBGYN at SVMC Healthcare for Women and serves as Chief of Staff at Salinas Valley Memorial Hospital. Dr. Beck enjoys employing her skills in prevention, education, surgery, delivering babies, and helping women achieve and maintain optimum health. Dr. Beck is board certified by the American Board of Obstetrics and Gynecology. Joining her is Dr. Joanna Oppenheim. She is a family medicine physician at Salinas Valley Medical Clinic Prime Care in Salinas. Dr. Oppenheim takes the approach of educating her patients on the causes of disease and how lifestyle impacts their overall health and well-being. Dr. Oppenheim is board certified by the American Board of Family Medicine and is also board certified in obesity medicine. Thank you both so much for being here today.
Thank you for inviting us.
I look forward to this Ask the Experts presentation. Dr. Oppenheim, let's begin with you. What is the most important thing that a woman can do right now, not just for her own health, but for the health of her family?
Well, I think in this day and age, I think the most important thing a woman can do for herself and her family is get her COVID vaccine. We are very, very fortunate to live in a pretty historic time where we are able to get a very useful and effective vaccine in such a short time against a virus that has really hurt many, many Americans. We're very fortunate too is that the age for the vaccine is now 12 and above. So the Pfizer vaccine has the emergency use authorization for ages 12 and above. And I really think that the most important thing anyone can do is get yourself vaccinated, get your children vaccinated, get everybody around you vaccinated. We know it is a very safe and very effective vaccine, and we have it available in Salinas. We have a vaccine clinic every Wednesday on 611 Abbott Street. We will be giving the vaccine for 12 and above. We give the Pfizer vaccine. It's preferable to make an appointment, but if you don't have time and you happen to be driving on Abbott Street and you see the vaccine open clinic sign and you'd like to come in and get your vaccine, please do. I can't encourage you anymore to please get the vaccine. It is one of the most useful tools we have to get out of this pandemic and also protect our community so we can open up safely over the next couple of months. And I think, Dr. Beck, I'd like to get your opinion on whether or not pregnant women should receive the vaccine.
Yes, and first though, I was going to jump in just as a mother, having two teenagers who've been vaccinated. One is fully vaccinated and one has received her first dose now that above 12 is available. For patients who are between 12 and 18, you do need to have a parent present for the vaccine clinic, but I definitely recommend, as with Dr. Oppenheim suggested, is getting your family vaccinated, including your children. But if you do take your child to the vaccine clinic, make sure there's a parent with them. And then as far as pregnancy and lactating women, the American College of OBGYN has been pretty clear from the beginning that the COVID-19 vaccine should be offered to all women, pregnant, lactating, and non-pregnant. And although pregnant women were not included in the initial studies for the mRNA vaccines, there have been some follow-up studies, and so far there have been absolutely no concerns regarding pregnancy. There have been no increased risks of congenital anomalies. There have been no increased risk of miscarriage, no increased risk of preterm delivery. we feel like it is very safe, but it's definitely up to the woman and her doctor to decide what's best for her. It's a risk-benefit analysis, and we absolutely respect if a pregnant woman wants to hold off on getting the vaccine until after she delivers. We think it's very safe, but we respect that choice. And if a pregnant woman chooses to wait until after she delivers her child to receive the vaccine, then we strongly recommend she has to continue to be vigilant. She must, continue to wear a mask and have people around her wear masks. She should encourage her family to be vaccinated to protect her and her baby. Women who have received the COVID vaccine, we also have done studies that show that the woman can pass on those protective antibodies to her child through either the placenta if she's vaccinated during pregnancy, or through her breast milk if she's vaccinated after delivery. So we do know that the mom can really protect her baby as well with those antibodies. So we strongly encourage all women to receive the vaccine.
Okay, thank you for that great information, great advice to both of you. Speaking of COVID-19 and this pandemic, it's been a very long year, a very difficult year. We're slowly making our way out of it. We've been indoors, the gyms were closed. Obviously, you could exercise outdoors. Your physical health and your mental health go hand in hand. So how do we get back on track, Dr. Oppenheim?
Yeah, so this year was obviously difficult for nearly every person that I've met. The combination of the level of uncertainty, the loss of control we felt over what we could do and what we couldn't do, and the power that we had in our lives was really difficult to deal with. It's interesting, I've had some patients that have sort of flourished in the pandemic, where they took this opportunity to kind of slow down a little bit more, eat better, take better care of themselves emotionally. But the vast number of people, I would say at some point in the last year, have taken a hit emotionally, either with increased anxiety, depression, lack of sleep, poor lifestyle habits or choices where they just felt they were really stressed, so went to some sort of unhealthy lifestyle choices. So, I think that when I was thinking about this, I think a lot of how you deal with your mental health, it depends where you're starting from. And so kind of the way I think about it and explain it to my patients is that, you have the base of mental health. And this is really where you think about, well, how is your life set up? Are you eating the right foods? We know that eating foods that are high in nutrients, very nutrient-dense foods like fruits, vegetables, whole grains, beans, even, some lean fish, can really help make you feel better. So we know that certain foods help make you feel better, and there are also certain foods that make you feel worse. So people don't feel great if you eat let's say a meal that's very high in fat and sugar. And so this does affect your mental health as well. So the first thing I try and tell patients is, look, you have control over what you eat for the most part. I mean, some of us don't, and that's another issue. But if you do have choices, try and pick a better real food kind of choice. The second sort of part about this is really regular exercise. And I think most of us sort of associate exercise with sort of weight loss or maintaining weight loss, but exercise has these benefits that have nothing to do with your weight. And so when we look at people who exercise regularly, and when I mean exercise regularly, I don't mean they're like sweating it out and grunting it out with this high intensity exercise an hour a day. These are people that are just moving. So whether it's walking, yoga, swimming, doing a high intensity exercise, there are these certain chemicals that get released when you move and you sweat a little bit. They're called endorphins, and I think all of us have felt them at some point if you have been active. And it really makes you feel good. I mean, there's not a lot of people that, after exercise say, I wish I didn't do that. Because most of us actually feel really good after we exercise. And the nice thing about that is you don't have to do something for an hour. You can get this kind of high after 10, 15-minute walk or a jog or doing burpees or sit-ups or anything like that. So what I really encourage people is, even if you don't have a lot of time, you might just want to do a 10-minute workout, whether it's walking around the block. There's this really cool 7-minute workout that you can Google. There's an app for it that people can do. And I tell people, do it as many times as you want. And that can make you feel better emotionally. Other things that we do that help with mental health, sleep is paramount. So when people are sleeping less than 7 hours, you know, your brain is that area of your body that really helps control and helps you regulate your feel-good hormones. When your brain hasn't gotten the rest that it needs, it kind of just, it's like zaps. It doesn't work correctly. And so we know the less you sleep, the worse you feel. And, you know, we've all felt that. If you have one night where you don't sleep very well, we all don't feel as good the next day. And for some people, if you compound that night after night, you know, by the end of the first week of not sleeping, you can be really grumpy and kind of anxious and not feel so good, which can manifest itself as depression. There are other things that I also kind of put in the toolbox to deal with anxiety and depression, and things like meditation, learning how to focus your mind, either with deep breathing or visualization, can be really helpful. And again, you don't need to do this for an hour at a time. Even sort of taking a mini time out and kind of just sitting quietly and just taking some deep breaths or thinking about something that makes you happy can really shift your mood and attitude. The last thing is, sort of for this base, is you need to take a look at kind of your drug and alcohol consumption. If you're drinking a lot of alcohol or you're relying a lot on marijuana, that can actually have a negative effect on your brain as well. You know, a lot of us will, you know, if you've had a stressful day, it's not uncommon to have a glass of wine when you get home. It's one thing to do that once in a while. It's another thing when that escalates and now you're drinking 3 or 4 glasses of wine a night. And we did see a lot of heavy drinking earlier in the pandemic. I think I remember last summer seeing a lot of patients, and it struck me, you know, many people were going to alcohol just, I think, for stress relief because it was such an uncertain time. You know, I've noticed that as the pandemic has gone on, we've all kind of, you know, most of us have recognized that might not be such a good thing and have reduced that use. Now, if that's not enough and people are still feeling really anxious and depressed, where it's really affecting their day-to-day activity, the next step would be sort of maybe even adding some psychotherapy. So this would be seeing a therapist who specializes in treatment of depression and anxiety. They use certain tools like cognitive behavior therapy. And this can be very helpful, again, to direct your brain and train your brain in how to deal with the feelings of anxiety and depression so that it doesn't sort of take you down. The interesting thing is what we've seen over the last year, what's been so great for this field of medicine is that we used to, you know, traditional therapy was you made an appointment, you went in to see your therapist for an hour. And for some people that was a barrier. And what we found now using telephone or Zoom or video conferencing has been able to be very helpful for patients because you can do this from the comfort of your own home and it's still very private. So it remains to be seen if this is something that will continue to be offered as time goes on. I do know that in Monterey County, we don't have enough therapists, and it's hard for people to get in sometimes. There are some online platforms that I've sent my patients to when either there have been insurance issues or they need help quicker than we can get them into. One being betterhealth.com, and you can look them up online. So I think the availability of therapy in this day and age has really sort of blossomed, where we have multiple avenues to get the help that we need. And the next step above that is if that doesn't help, sometimes you do need medication, and we have some great medications out there that we use in the short term that can help with anxiety and depression. And then if that is not enough, the final step is I kind of say, look, there are some programs where people can go for a day program to help really deal with some of the issues of anxiety and depression. And so I encourage patients, you know, if you don't know where you are and if you're just feeling really out of control and you want help, please talk to your doctor about it. There are so many options. We want to help. We know this is a problem, and we at SVMC are really trying to address that. We have our own behavioral health therapists available in our behavioral health clinic, and we can help direct you up to see them if needed.
Great, thank you for that information. And before we move on to the next question, Dr. Oppenheim, do you want to talk a little bit about Blue Zones Project? This is an organization, it's a project that's doing wonderful things, not just in the Salinas area, but in other parts of the county.
Sure, so Blue Zones has been out for quite a while. It was an interesting start. There was Dan Buettner was this guy, a journalist, I think, who went around the world looking for areas where people lived the longest, and he wanted to kind of see what were some of the things that these people were doing. And he went to multiple different places like Greece, Japan, Costa Rica, even in California, Loma Linda, we have a Blue Zones area. So Blue Zones areas are areas where people live a long time with less of disease than the rest of the population. And what he found was that there were several things that could really help people live a long time without disease or reduce their risk of disease. And they include basically eating a more plant-based diet. So when they looked at the diets of these people in several regions of the world, they ate meat maybe 5 times a month. They ate seasonally. They ate what food was local. It was real food, so nothing processed. They moved a lot during the day. They didn't necessarily go to the gym, but there was a lot of movement in their day-to-day life. They slept at least 7 hours a night. There was a lot of connection that they found, so connection within the community, either through volunteer work or with church organizations. Like that feeling of belonging really shows that you can increase your life expectancy if you have that. The feeling of having purpose in your life. Were some of them. One of them was wine at 5, which, you know, it sounds good if you can keep it to less than a glass a day. But those were some of the things that he found. And the nice thing is what we're doing in Monterey County. Blue Zones came to Monterey County, I think, in 2018, and it's an organization that helps to try and build the surrounding community in a way that makes the healthy choice the easy choice. And so it's not an easy undertaking. Our Blue Zones team in Monterey County is fantastic, and they've been doing some really good work. And so I encourage anyone who wants to get involved, and I think it's bluezonesmontereycounty.com. Please check them out. They have workshops before COVID, and I'm sure when we open up again, we were doing walks on Saturdays, group meetings, purpose workshops, cooking demonstrations. And this is a great way, if you're interested in learning, some tips on how to live longer, which I think most of us want to. But it's not just living longer, but it's living better as you live longer. And this is a great organization to get some more information from, and also volunteer and learn more from the organization.
Absolutely, and you also have the opportunity to meet other people in your community and also make a difference, not just in your own health, but also in the community. Thank you for that. Yeah. To our viewers right now, please, if you have questions, write them in the comments section. At the end of this presentation, we will answer. No, I will not answer them, but Dr. Beck and Dr. Oppenheim will answer those questions for you. We're going to move on now to Dr. Beck. How often, and this kind of goes with the first question, Dr. Oppenheim, that I asked you, but how often should we be seeing our primary care physician and those physicals?
Sure. So it's an individual approach, because we should be talking to each patient and looking at them as an individual. But a general rule of thumb is at least seeing your physician once a year. Sometimes there may be times in your life where you can space that out to 2 or 3 years, but generally speaking, once a year. Because this annual exam, it's not just a pap smear or not just getting birth control, which is what a lot of women sometimes equate their annual exam with. But these annual exams, we're checking blood pressure, we're talking about weight, talking about mental health, as Dr. Oppenheim just was talking about. We will make sure that you're updated on all of your immunizations. As we were talking about the COVID vaccine, that might be something that your physician brings up at your annual exam this year. Have you been vaccinated? And then we're going to also be talking about screening exams that are necessary. So screening exams like mammograms and pap smears and colonoscopies, and when they are indicated. And that sometimes changes based on your family history. So really, there's a lot that happens in that annual exam that I think patients don't always realize, that we're actually getting quite a bit of information, even though I think sometimes women think they're just coming in for their pap smear. No, we're doing quite a bit more, and as the pap smear recommendations have changed over the past few years. So now pap smears are recommended every 3 years as opposed to every year. So women are hearing, oh, I don't need a pap smear, so I don't need to go in. Well, even though we're spacing the pap smears out, we still want to see women every year to do these other screening exams, to do breast exams, to check blood pressure, to check in mental health. So really, once a year is probably the rule of thumb for that.
Okay. And to follow up with that question, when should women start getting some of these exams, particularly the pelvic exams, the pap smears? And what if there is cancer in their family?
Yeah, that's a great question. And definitely if there's cancer in the family, it really depends on what the cancers are. And we'll be doing those family histories and really digging into like, oh, should we do some more genetic testing to see if this woman is at much higher risk of other cancers as well. But for the general population, we start doing pap smears at age 21. And like I said, every 3 years, assuming they're normal, every 3 years until age 65. At age 65, if a woman has never had an abnormal pap smear and no history of dysplasia, then we can often stop doing the pap smears. If a woman has had a hysterectomy and no longer has a cervix, she does not need to have pap smears anymore, but we still recommend coming in for the annual exam, again, for all the other reasons that I just talked about. And then for teenagers, it is recommended, the American College of OBGYN does recommend having their first appointment with either a gynecologist or a family practitioner or a pediatrician who has an interest in adolescent medicine, having that first appointment in the teenage years between ages like 13 to 18. This appointment does not need to include a pelvic exam at all, but it's really an exam to introduce that girl, that teenager, to what a gynecologist is, knowing that there's a place where they can talk to a doctor about their periods, about puberty, about birth control, just all of those important conversations. And so it is recommended to have that first appointment in the teenage years, even though that does not generally does not include a pelvic exam.
Okay, that's great information. I want to follow up with a question regarding cancers. While you can screen for some types of cancers, for others you can't. One of them is ovarian cancer. Why is that, and what do women need to know about ovarian cancer?
Sure. Well, an ovarian cancer is the scary cancer to women. So in order for a disease to have a screening test, a good screening test, the screening test has to be able to detect the disease at a very early treatable stage. That the screening test has to not have very many false positives, meaning we don't want everybody to screen positive even if they don't have the disease. And then we also want that screening test not to have false negatives, meaning if the woman has the disease, we want that test to pick it up. So pap smears are a great example. Pap smears have a very good track record as far as picking up cervical changes before it becomes cancer, so cervical dysplasia, well before it's cancer. So we can treat those changes before a woman ever develops cancer. And there are very few false positives and very few false negatives. So the pap smear was an amazing screening test when it first came out. Unfortunately, ovarian cancer does not have that screening test. There just isn't a test available yet. the medical community is working on it, but the test has not yet come out that meets all that criteria. So there isn't a good test that we can screen everybody, the general population. So really the best things that we count on are family history, and about 10% of 10% of women who have or who are diagnosed with ovarian cancer do have some type of genetic predisposition to cancer, but that means there's 90% that do not. And so then the next thing is we're just really being in tune with symptoms, and just making sure if a woman comes in and just tells me that she's just not feeling right, she's having abdominal bloating, having losing weight and she doesn't know why, pelvic pain and we can't explain it, then that may be someone that we're just going to look more closely. If we do identify a woman at high risk for ovarian cancer, if she has one of the genetic mutations that puts her at higher risk for ovarian cancer, then there are some things that we can do, such as like frequent ultrasounds. And then there are also some, we call it oncoprevention, preventing the cancer. So it's been shown women on birth control pills, if a woman takes the birth control pill for 5 to 10 years throughout her life, that decreases her risk of ovarian cancer. We also know that when a woman decides that she no longer wants to be fertile and she wants to have permanent sterilization and she wants to have her tubes tied, if we remove her tubes, that has been shown to decrease the risk of ovarian cancer. So there are also some things that we can do to reduce the risk in women, but unfortunately there's not a screening test yet for all women for ovarian cancer.
Hopefully there will be one sometime in the future.
Yes, that would be wonderful, hopefully. And then the other thing is, even though ovarian cancer is, it's so scary to so many women, it is still a very rare cancer. So it affects 1% or less of the female population. So although we're all very in tune to it, it is a rare cancer.
Okay, thank you for that. I do want to spend some time talking about contraception and family medicine, or family planning, I should say. What are the best and safest methods of birth control? And Dr. Oppenheim, I'll send this one to you.
Okay.
Although the
So
best
I
is the
think
one she'll use.
the best is the one, exactly. The best is the one that the woman or the man will use. I think the important conversation to have is to understand that if you are the parent of a teenager, this is something that needs to be discussed early on. Teenagers, in my kind of rule of thumb, if they're even thinking about it, we really do talk about the risks and benefits of starting birth control. We have many, many different kinds of birth control, so I think it's really important to individualize the birth control to the patient. It has to be the safest one for the patient. It has to be one that can be easily used, that the patient will use, and do the least amount of harm. So I kind of divided up into a few. We know the condom method, which is a barrier method. So this is something that the man puts on his penis and prevents sperm from entering the vagina, so the woman doesn't get pregnant. I think all parents need to teach their teenagers how to use this. It's a very uncomfortable session, but I do think that kids need to learn how to use condoms appropriately, and it needs to be reinforced at each and every time. After condoms, which are easy to get, the next step I talk to women about now are hormonal options. And so hormonal options are typically the first kind of batch has combined hormone contraceptive, and this can be given in several different forms. And the way it works is it basically levels out your hormones so that you don't ovulate. If you don't ovulate and you don't make an egg, you can't make a baby. So the nice thing about this, it used to be the pill is one of the most commonly used medications around the world. This is something that you would take every day, and if you take the monthly pack, you would get your period in the 4th week. week. There are birth control pills that you can take now for 90 days at a time, so you can push back your period, which is very helpful. Benefits of birth control pills, one of them is reduction of ovarian cancer, as we just heard, but also they've been around for a very long time. We've definitely reduced the amount of hormone that we use in the birth control pill compared to the 1960s, which leads to things a little bit safer for women, easy to take, easy to stop if you desire pregnancy. There is a small risk of blood clots with taking birth control, so I think that if you oral contraceptives, so if you smoke or if you're at higher risk or have a family history of blood clots or yourself have a family history, this is not a good option for you. Other ways that you can deliver the same hormone would be either a patch, so this would be a patch that you could slap on your arm or your backside or the lower abdomen. It's about this big, and you take it off, you put it on every week. The last week you take it off, that's the week you have your period, and then you restart the cycle. Another option for delivery is a vaginal ring. I unfortunately don't have one, but it basically looks like a plastic hair tie, and you just squeeze it and you put it into your vagina, you kind of shove it up high in there, right like a tampon, and you leave it in there for 3 weeks, and then at the end of 3 weeks, you just pull it out, you have your period, a week later, you put a new one in. And those are all really good options. Again, if you have a patient that maybe takes other medications and it's easy for them to remember to take a birth control pill, that's the one you go with. I really tell the patient, I ask the patient kind of what delivery method is easiest for you, which one are you gonna take? And that's kind of how we decide if they want combined contraceptive management. The other one is sort of Nexplanon and progesterone. So this would be, I have one here to show you. This is kind of the arm implant. It's called Nexplanon, and it is a hormonal insert. It looks like this. I don't know if you can see it. It goes in your arm. We typically put it in your arm like this, and it stays in for about 3 years. And then you can take it out. That's a really great method of birth control for women who want to put it in, not think about it, and not have to worry about it. That's a great option. It can sometimes cause some irregular bleeding in the beginning, but it typically goes away, and then your periods can shorten up a little bit. Another one that I really like to use is an IUD. So it's an intrauterine device, and here is one here. And if this is what your uterus looks like, it's an easy in-office procedure. All you would do is you could come to your physician and you put it in the uterus. Obviously, this is not pulling up, but this is where it would go. The Mirena is 5 years. It has progesterone hormone in it. It acts just locally, so it's not systemic in your blood. And this prevents implantation of an egg, which would happen kind of around here. So it prevents pregnancy that way. This is another great option for women who, again, want something one and done and not have to think about it. It also works wonders on heavy periods. It helps with heavy periods early in life. It helps with heavy periods later on in life too, which is really kind of nice. And you can pull this out anytime you desire pregnancy before the 5 years, and it's easily replaced. And so this is something that you could use for a long time as well. We have a smaller one for teenagers that lasts 3 years. The other one is a copper IUD. This one would last for 10 years. And that, we don't use it as much anymore. The bleeding tends to be heavier, I think. And so this one seems to be the most common one to use. So again, with different forms of birth control, I think if you're thinking about having sex, you need to think about what kind of birth control you want to use. If you are having sex, and are not on any form of birth control, you're de facto trying to get pregnant. So if you don't want to have a baby, I really want you to think about what birth control you're going to use. And again, there's so many different options, and I think we need to individualize it because there's some birth controls that you probably shouldn't be using if you have other health conditions. So that's something that you can talk to your physician about. And then for women who are going into menopause, if you're still having periods, I still advocate that you do some form of birth control, even though the risk of pregnancy is less, but it can be quite interesting if it does happen to you. So
it's less, but not zero.
Not zero, right? So I do think that that's something that you should think about till the very end of your menstrual cycles.
Yeah, and I'll jump in.
Yeah.
Definitely, I think for teenagers, 2 forms of birth control So condoms, because condoms will protect against STDs. None of the other contraceptives protect against or STIs, I guess now, the sexually transmitted infections. So condoms for sure. Everybody should be using condoms unless they are in a monogamous long-term relationship and everybody has been tested and we know that there are no infections floating around. So condoms for everybody, and then having a more effective method as well. So either a hormonal method or the non-hormonal IUD, which is the copper T, which, as Dr. Oppenheim says, we don't use as frequently anymore, but some patients really want that non-hormonal, effective, long-term contraceptive, and so for those patients, it's a great option.
And I did also forget to mention the Depot shot, which is an injection every 12 weeks that you can get in your arm. Again, fairly easy, one and done, but that is hormonal.
Okay, great. Thank you for that. What about women who want to start a family? What do they need to do before becoming pregnant?
Yeah, so be as healthy as you can be, and that's for all aspects of health, right? So we want you to definitely be thinking about and planning and wanting a pregnancy. We want your weight to be at a healthy weight. We want you to, if you are on any medications, we want to make sure that those medications are compatible and safe with pregnancy. And if we can stop medications that are not compatible and safe with pregnancy, we want to do that before you conceive. So if a woman is on any medication, she really should have a preconception counseling appointment with her physician to make sure that all the medications she is on are compatible with pregnancy. We want to make sure that you're taking a prenatal vitamin every day prior to conception. So a lot of women think, oh yeah, once I get pregnant, I'll take a prenatal vitamin. Well, actually, we want you taking that prenatal vitamin prior to conception. There are actually some anecdotal studies that suggest that women who take a prenatal vitamin prior to pregnancy might have less nausea and vomiting of pregnancy. So that in and of itself is a reason to take the prenatal vitamins prior. But more importantly, the folic acid that is in the prenatal vitamin has been shown to decrease birth defects. So that's the more important reason to take the prenatal vitamin prior to pregnancy. We want to make sure you're up to date on all your immunizations prior to pregnancy. And as we were talking about COVID earlier, the American College of OBGYN absolutely recommends women who are thinking about getting pregnant to get their COVID vaccine prior to conceiving, or even while you're trying to conceive. Absolutely don't put off getting the COVID vaccine for that. There is absolutely no scientific evidence supporting any risks with fertility and the COVID vaccine. So getting up to date on all of your vaccines, and then just eating healthy. We don't want you smoking during pregnancy. We don't want you drinking alcohol during pregnancy. So just having a healthy lifestyle.
Great advice. Thank you for that. We're going to move on a little bit here. So now the woman is pregnant, expecting that first or second or third child. We do want to tell people that Salinas Valley Memorial Hospital has an obstetrics emergency department. Dr. Beck, can you elaborate a little bit about that? What does that mean?
Sure. So, again, I can't remember what year we opened our obstetrics emergency department, but it's, I believe, probably around 2016, 2017. And it's great. We have a board certified OBGYN in the hospital 24/7, and they are there for any and all pregnant women over 20 weeks of gestation. So if a woman comes in with any obstetric concern and she's beyond 20 weeks or beyond 5 months, she will go up to the OB emergency department, which is located on the second floor, right next to labor and delivery, and will be seen by our OB/ED physician. And then since we have opened up this OB/ED, we have a physician 24/7 in the hospital, we've been able to expand our services in labor and delivery to now allow for trial of labor after cesarean and vaginal birth after cesarean. And that was one of the big reasons for us to open this OB/ED, was to be able to expand our processes and allow for women to have a vaginal birth after cesarean section. So it's been a great thing. And then also every once in a while, somebody will come into labor and delivery and deliver their baby within minutes, and their regular obstetrician may be in the office across the street, and it's been really great having a physician present 24/7. So we know that our patients are well cared for and safe at all times.
And have peace of mind.
Absolutely peace of mind.
Okay.
That's great.
Well, I want to change topics now to something that was a bit controversial. Actually, it was very controversial about a decade ago, and it's regarding Gardasil 9. It's a vaccine that helps prevent cervical cancer. Dr. Oppenheim, can you please provide more information about Gardasil 9, the human papillomavirus, HPV, and its link to cervical cancer?
Yeah. So I think this vaccine is actually one of the coolest things out there, because you don't have a lot of vaccines that can actually prevent cancer in somebody. I thought it was the coolest one until the mRNA COVID vaccine came out, but it's kind of close neck and neck. So HPV, human papillomavirus, it's a group of viruses that can cause disease anywhere from as benign as sort of like a wart on your hand to warts, not so benign, on your genital area, penile warts, and then also for some strains of the HPV, they can cause cervical cancer. And so what we now know is that there's a link between chronic HPV infection and cervical cancer. So HPV is actually very common. It's actually so common that we don't even check people under 30 for it unless they have an abnormality on their Pap, because data shows that for sexually active young people, because it is a sexually transmitted virus for the cervical cancer causing ones, it's very common. So the important things to know about HPV is that HPV infection is quite common if you're sexually active. The nice thing about it is that for most women with a healthy immune system, you can, about 70% of women will get rid of that HPV within about 2 years if they have a healthy immune system. And even some people with a healthy immune system will still have HPV. And those are the patients that we really worry about. We don't worry so much about cervical cancer for women who have an HPV infection that lasted a year. It's gone, it's not really going to cause a lot of disease. We really worry about that smaller percentage of people that have persistent infection with HPV. So what we know is that over time with infection, the cells change slowly, but they will develop, they can develop into cervical cancer. This is why Pap smear screening is so great, because it's a form of screening that can pick up the disease very early on in the disease before you even get to the cancer stage. So there's a lot of intervention you can do to prevent those abnormal cells from becoming cancer. So the Gardasil vaccine, though, the way it works is it boosts your immunity to to certain strains that cause cervical cancer. And when you have a stronger immune system and your body sees that HPV, you can fight it. And so you're much less likely to have a chronic infection with HPV. And so this initially came out in 2006. And initially it was only FDA approved for girls for short term. Now we know it's FDA approved for boys as well, because boys help transmit the virus. So you've got to really vaccinate both parties. Girls obviously are the ones that can get cervical cancer, but men can have, it's rarer, but you can get some infections in your genital area from HPV as well. And so now the current FDA approval is 9 and above, 9 up to 45 in certain circumstances, but definitely 9 to 26, boys and girls. The vaccine is typically given around 11 is typically when most parents would prefer to give the vaccine. And we give it in 2 shots before the age of 15. If you're after 15, it's 3. It's very, very effective if given before initiation of sexual activity. And the cool stuff is the studies now, because it's been out for so long, they've really shown a reduction in cervical cancer related to areas where people get this vaccine very frequently. So again, it's such a cool vaccine because I feel like if I could get a vaccine for colon cancer, breast cancer, ovarian cancer, people would line up for it. So I strongly encourage all parents to get this vaccine into the arms of their children, boys and girls. The biggest issues that I had, especially early on, was this fear that if you gave your child a vaccine that prevented a sexually transmitted disease, that it would promote sexual activity. And what we have found is that that's not really the case. Most 11-year-olds, 11 and 12-year-olds, they're not thinking about that. And if it's presented to them as this is what's going to help prevent disease for you, I don't even think they think about it. So I've heard less and less of that over time because I think we've had so much experience with this vaccine, and now that we have so much data showing how safe and effective it is, most parents aren't really worried about it. If you are worried about the vaccine, I would highly encourage you to speak to your child's physician regarding that. The data is really clear. It really helps save lives down the road. So I would strongly encourage you that if your children haven't had it, no matter what age they are, I would get it. Even if you started having sexual contact, the immunity is not as, the outcomes aren't as, the immunity isn't as strong because they might have been exposed already. But it's better to have some protection because the Gardasil will have, the vaccine protects against certain strains of the HPV vaccine, the HPV, the human papilloma virus. So I would strongly encourage you to get it. And if you yourself are worried about contracting HPV in your 20s or even your 30s, it's still FDA approved for you as well. I've never really had anyone come back and tell me their insurance hasn't covered it. We know that public health departments give it. The VNA has a travel clinic. So I would contact your insurance if you're worried about it. But this typically is now one of the very common vaccines we give, especially around that 11-year-old visit where kids are coming in for their middle school. Everyone needs a Tdap. So that's required for middle school. So I try to give it to them with that at the same time, and also their meningitis vaccine. So again, really cool vaccine. Again, get it if you have not had it yet in those age groups.
And just as you were answering that question, Dr. Oppenheim, someone texted me the following question. Can you still get the HPV vaccine if you've been diagnosed with it before but no longer have it?
Yes.
Yes.
Because
there you go.
You might not know what strain of HPV you had before. So let's say you were diagnosed with HPV before, but it wasn't the strain that caused cervical cancer, so it's 16 and 18 in Gardasil. You can still protect yourself against that. So yes, absolutely, please get it.
Great,
Yeah,
great question.
and that's pretty clear out there that we should give HPV vaccine to anybody who wants it, even if they've already had HPV, even if they had one of the cancer-causing strains. There are other cancer-causing strains that the vaccine will protect them from. So it's recommended.
Okay, great. Let's move on now to menopause. When does menopause, that's a loaded question, right? When does menopause begin? What is happening in the body? What can you tell us about this?
Yeah, when does it begin? Well,
Too soon.
right now, no. Menopause, I equate menopause, I think puberty and menopause are two times in your life where you're transitioning, right? At puberty, you're transitioning from childhood into adulthood, and some kids just cruise through puberty, no problems at all. some kids, have a little acne, maybe a little mood swing, not so bad, and then other kids just have a really tough time, and the mood swings are rough, and the family is, on edge for a few years, and then we get through it. Well, so now we go to menopause, and I think it's a transition. It's a transition from childbearing years of your life when your ovaries are making estrogen, progesterone, to a time in your life where your ovaries aren't making estrogen and progesterone, and you're no longer childbearing. And that transition is easy for some women. Some women, they just wake up one day and never have another period, and that was their menopause. Other women will have some hot flashes, night sweats, last for a couple years, and then they do fine. And then there are women who just have horrible symptoms of night sweats, insomnia, hot flashes all day long. They're mood swings, weight gain, basically you name it, and it could be a symptom of menopause. And then when does this happen? Just like puberty is an age range, so is menopause. So the average age of menopause is 51, and we define menopause as 1 year without a period. So so just because you don't have a period for a couple months, you're not technically menopausal until you go for a full year without a period. So the average age in the United States is age 51, but some of these perimenopausal symptoms can start even as young as the early 40s, and then the menopausal transition can really last even into your late 50s. Typically, sort of a 3-year transition, but 3 to 5 year transition, but definitely women can have symptoms greater than 5 years. Most women don't need medication per se; they just need a lot of reassurance and maybe short-term hormone therapy just to kind of help with that transition. But most women can kind of do that transition without any medication. But if a woman is having just a really tough time with the hot flashes, the night sweats, the mood swings, there are medications that we can use, hormonal and non-hormonal medications, to help with that menopausal transition.
Okay, great. Thank you for that. I do want to move now to our Facebook questions. We have some really good ones. I'm just going to go down here, and hopefully we can dedicate the next 10 minutes or so to answering some of these questions. Rosa asks or says, I've been excessively sleepy even though my sugars have been normal and my blood pressure is normal. I do have primary biliary, something I can't read here, which is an autoimmune disorder, but I'm super sleepy. I'm 48 years old. What causes excessive sleepiness?
I'll defer to Dr. Oppenheim. I think it's probably primary biliary. Is that what it
Well, I think excessive sleepiness can be a symptom of many, many things. So the main things that I've seen excessive sleepiness in sort of day-to-day practice here, and I'm not really quite sure what autoimmune thing this person has. So, first of all, are you getting the right nutrition, or are you anemic? Is your blood count low? Do you have enough iron? Do you have enough B12? Do you have enough vitamin D? Those are all levels that can be checked. That's one thing. Sleep apnea is very common. So sleep apnea is a disorder where when you sleep at night, your airway gets blocked off. And so what happens then is that people will they'll stop breathing, it's called an apnea, and they'll be asleep, but they'll wake up, but they don't remember waking up a lot, and they'll wake up in terms of like having to breathe. So people, they'll stop breathing, and then they go, and sometimes if you sleep with someone, they can tell you that happens. So sometimes people aren't aware that they're doing that. The issue with that is you might be sleeping at night, but you're not really getting restful sleep, so that it's basically not sleeping at all, and you'll be excessively tired for the rest of the day. that's a very, very common cause. Depression is a common cause that I see of excessive sleeping. But I think with issues like this, I think it's really important that you talk to your provider and really think about kind of what's happening in your life so you can give a really good history, because unfortunately excessive sleep is like, it could be a sign of many other issues. If you are falling asleep, like if you're one of those people that you sit at a table and you just nod off like this, there's a disease called narcolepsy, where people will just fall asleep every time they sit down, and that can also be diagnosed via a sleep study and with a specialist visit. So I think it's important to kind of tease out exactly what people, I know this sounds silly because excessive, sleeping too much is sleeping too much, but the history is really important. So like, do you have a hard time falling asleep? Do you have a hard time getting up? Are you in bed for a long time? All those things are really important. So I think that having a good conversation with your physician can help tease out, and getting some basic blood work and some basic tests can really help rule in or rule out causes of excessive sleepiness.
No. And thyroid disease is a
thyroid.
common issue for women in their sort of 30s and 40s, so that might be another, sometimes that can be a cause of fatigue, and but that would be definitely talk with your doctor and figure that out.
Yeah.
Thank you for that question, Rosa. And I do want to add that we do have a sleep center at SVMHS, so you can definitely go to our website for more information or to make that appointment. It's svmh.com. I want to move on now to another question. 8-month postpartum hair loss, is that still normal? If concerned about thyroid levels and would like to get a blood test, do I ask OB or primary care physician?
Yeah, really, you could probably ask either one. And so definitely hair loss is very common, and that's, or usually it's more 4 to 6 months after delivery, but it can sometimes be a little bit longer. And the reason for that is sort of, during pregnancy, think of all of your cells are in growth mode. You're growing this baby, everything's in growth mode, and so your hair follicles are all in growth mode as well. And when you're not pregnant, some of your hair follicles are in growth mode and some of your hair follicles are in fallout mode, and it's this equilibrium. During pregnancy, everything kind of gets into growth mode, and so 4 to 6 months later, they're all in fallout mode at the same time until your body kind of then reaches that equilibrium again. So it's very common to feel like you're losing too much hair, 4 to 6 months, but we always just check a thyroid and also a CBC to make sure you're not anemic. And then if those 2 tests are normal, we usually just reassure. So I think either your obstetrician or your primary care physician should be able to order that test for you.
I would say, speaking about hair loss, for those of you who've had COVID, it's been interesting. I've seen quite a few patients who a few months after COVID have had hair loss as well. That seems to be coming back, but that's just an aside. So if you lost a bit of hair after COVID, I don't think that's an too uncommon thing.
Okay, very interesting. Good to know. Thank you, Dr. Oppenheim, for that.
That's something I saw.
Another interesting question here, and you did talk about this, Dr. Beck, but just in case, for some people who may have started watching this afterwards, Jeanette here asks, after hysterectomy, do I still need a PAP?
So it depends a little bit on the type of hysterectomy. So most women who have a hysterectomy have their cervix removed at the time of hysterectomy. And if you have had your cervix removed, then you do not, and you have no history of cervical cancer. And the reason for your hysterectomy was not because of cervical cancer or severe dysplasia, then you do not need to have Pap smears. If you had what's called a supracervical hysterectomy, meaning you have a hysterectomy that we took the uterus out, but they left the cervix in place, then you are just like every other woman who still has a cervix, and you should have just the routine Pap smears every 3 years.
Okay. Diana, her question is, if you have dense breasts, how can we check for possible breast cancers?
So For the dense breasts, so we still just recommend mammogram as a routine mammogram, and then they can also do it's called an automated whole breast ultrasound, where they can do an ultrasound of the breast as well. Sometimes the ultrasound is covered by insurance and sometimes it is not. So the standard of care is still to perform mammogram as your first line, but sometimes you can augment that mammogram with an ultrasound. The one thing, the breast density tends to become less dense as you age. And I forgot to mention this earlier, there's a bit of controversy about when should women start having mammograms. And it really just depends on which society you follow. So that's definitely, for women in their 40s, most of the societies will recommend to just individualize and talk with your doctor and decide when or if you should have mammograms. And then everybody agrees to start mammograms at age 50 and above every 1 to 2 years. I usually follow the American Cancer Society, which recommends starting screening at age 45, unless a woman has a family history or some reason to start earlier, in which case we'll start at age 40. But the breast density tends to be, or the breasts tend to be more dense the younger they are, so that can sometimes cause its own issues. So, but if you do have dense breasts and you are having screening, mammogram first, and then you can augment that with an automated whole breast ultrasound.
Okay. Thank you. We have another question from Jeanette. She's asking, what about cervical cancer after hysterectomy? I'm assuming she means, can you still have this type of cancer after you've had a hysterectomy?
Well, if you still have a cervix, then it is possible. If you don't have a cervix, then you can't have cervical cancer. It's incredibly rare, but vaginal cancer is a possibility. But it's very, very rare.
And then she also follows up with another question. How about hormones after hysterectomy? Can you elaborate a little about that?
Well, so if the ovaries are left in place, meaning if they're not removed at time of hysterectomy, then you do not need hormones after hysterectomy. If the ovaries are removed at the time of hysterectomy and you are not already menopausal, then now you're surgically menopausal, meaning we just made you went through menopause in a day. And so some women who are surgically menopausal do benefit from hormones just to help ease that transition.
Okay, I just have time for one more question here. Is it okay to take prenatal vitamins if you are not pregnant?
Absolutely.
Yeah.
It's a great multivitamin.
Yeah.
There you go. All right. Well, I do want to thank you, Dr. Rachel Beck and Joanna Oppenheim, Dr. Oppenheim, for being here today. You've given us some very important, valuable information on women's health. So thank you for being here.
Thank you.
Thank you for having us. Thank you for watching.
Yes, and thank you for watching. This video will remain here on our Facebook page, so please share it, tell everybody about it. It's going to live there forever. And we absolutely encourage you to watch this again in case you missed the very beginning, and of course share it with your daughters, your mothers, grandmothers, everybody, including the men in your family. Next month we'll be back, and our topic will be men's health, specifically prostate cancer. So we'll see you then. Take care. Bye-bye.
Bye-bye.
Bye.
Are we still on?